Should you exercise while you're trying to conceive? If so, how much is too much and how much is not enough? There's so many confusing recommendations online. Today, we are going to clarify it with evidence and help you understand all about fitness and fertility while you're trying to conceive. I'm Dr. Lora Shahine, a double board certified OBGYN and reproductive endocrinologist, helping people build families for over 20 years. And one of the most common questions I have from patients is it okay to exercise while I'm trying to conceive? People have so many confusing recommendations from friends and family, from online, and the patient can feel sort of stuck in the middle of should you just maybe exercise a lot at the beginning of your cycle and then after ovulation, which you could possibly be getting pregnant, maybe stop. What about an early pregnancy? Like there's just so many things to be confused about, and I'm here to help. Listen, I love educating. If you are just finding this channel, welcome. Be sure and subscribe so you get my weekly videos all about reproductive health. There's two other ways to stay engaged and learn because I love educating so much. Number one, sign up for my weekly newsletter where I share educational content and recommendations that I have. And number two is my weekly podcast. You can find it on my YouTube playlist or anywhere you listen to podcasts. We have in-depth interviews and discussions all about fertility and reproductive health. And so those are many ways to stay in touch and learn. But today it's all about the confusion around fitness and fertility, and I'm going to clarify it. So let's get started. Today we're going to review 5 main topics. Number one, we'll go over just general guidelines for exercise for being healthy and being well. Why is it so important? Number two, we'll go over the balance of exercise when you're trying to conceive. What's too much? What's too little? Number three, we'll review some evidence. Like you should have some scientific studies to help you on this journey of trying to figure out what's right for you. Topic number four, we'll get into some specifics around PCOS or polycystic ovarian syndrome, share some studies on obesity specifically, and I'll share some information about exercise during IVF. Now stick around to the end because the fifth thing I'm going to go over is really just a summary of the evidence, and I'll share what I tell most of my patients while they're trying to conceive. Be sure and talk to your doctor about your personal situation, but I want to give you a general guideline about what I say most often. So topic number one, general recommendations around exercise. Exercise is key. It's one of the 4 pillars that I talk to all of my patients about when I'm thinking about lifestyle optimization to improve overall reproductive health. So we think about nutrition, sleep, emotional wellness or stress management, and exercise or moving your body. Exercise is so important to help you get that sleep that you need, to help with hormone balance, to help with regular ovulation, to help with metabolism and insulin spikes. Moving your body is essential for overall health and well-being. So, of course, there are times in your life where you can't move. You're recovering from an injury or your doctor has told you that it is not wise to move. But in general, moving your body is so important for cardiovascular health, your mental health, and your reproductive health. So trigger warning, when I'm talking about exercise and moving your body, sometimes people think that I'm only talking about like obesity or trying to exercise in order to fit a number on a scale. And that is just not the case. So there are studies that show that obesity is associated with poor reproductive health, like higher risk of miscarriage, longer time to conception, ovulatory dysfunction, and pregnancy complications. But people can be healthy in many different size bodies. And it's not just being overweight that might throw off hormones and reproductive health. It's also being underweight. And it's not just about a number on a scale. There's studies that show that there's actually lower fertility rates with a sedentary lifestyle, regardless of weight. So some people can maybe look great in an outfit, or, I know that that's beauty is perception, but just like maybe they are on the cover of a magazine because somebody else said that they look good, but they're sedentary. They're not moving their body. So they might be like in air quotes, normal weight. But if they're not moving their body, that's actually throwing off their overall reproductive health. So it's not just about number on a scale or fitting into a size of clothes or this BMI, this common number that's reviewed in studies. It's a calculation with height and weight to kind of fit this BMI. And if you're over this certain BMI, you're obese. You're underweight. That is just, it's an easy thing to report on in a study, but a BMI does not always reflect truly the health of someone. So these things are not perfect, but I'm really focusing on the importance of moving a body, not just to think about the shape of the body. Movement is important. So topic number 2, what's the balance? Like, okay, I should be moving my body, but like how much is too much? And you told me not to be sedentary, but like how little is too little? Kind of where is that balance? It's sort of exercise is sort of the Goldilocks of the lifestyle pillars when it comes to fertility. Too much is not a good thing, and too little is not a good thing. It's got to be somewhere in the middle. One study teaches us that moderation is key. It's a study out of Norway. It looked at over 4,000 women who were tracking their exercise routines and their fertility. And the study found that women who exercised regularly had more regular menstrual cycles, more regular ovulation. They had more balanced hormones, and that allowed for predictable menstrual cycles. It allowed for timing of intercourse and ovulation so that they got pregnant faster. Those who worked out to extremes, and in this particular study, it was women that worked out 4 or more times in a week and pushed their body to extremes like endorphin rush, kind of profuse sweating, or to the point where they're having difficulty, catching their breath, like that's considered extremes. Those women had a longer time to conception. So extremes are not so good, but moving your body is good. Another excellent review of just fertility in athletes, so people that are training for things, was done, and it's a kind of a scientific review. It goes into the importance of GRNH pulses from the hypothalamus in the brain to control hormones that are crucial for your menstrual cycle. And that can get disrupted in female athletes. And so it can show up as amenorrhea. So if someone's in an energy deficit, either they're over exercising or under taking in calories, their reproductive system can shut down. It can say, hey, we need to focus on running from the bear, in air quotes, not reproduction. This is not a good time to get pregnant. And that can show up in amenorrhea, or not having menstrual cycles, or very irregular menstrual cycles. But what's key and what's interesting in this study is it's not just that simple. You can't just say, oh, if you're having regular predictable cycles, then obviously you're not exercising too much, because this study also showed some research that kind of long distance, intense exercise training for kind of intense things like marathons and things like that can actually disrupt hormones and disrupt the GRNH pulses, but people could still be showing up with irregular ovulation and irregular menstrual cycles, but just taking longer to conceive. You can look at this in many different ways, and it's hard to study in a population and be able to tailor it to the person, the patient that is sitting in front of me. But, it's just too simple to say like, oh, you're normal weight and you're getting periods, therefore you're not working out, too much. And it does not also mean that you can't stop doing what you enjoy. Like, I don't want to take away, stress reliever and a really healthy thing, but I do talk to my patients about modifying, and I review these articles and kind of talk about a little bit of what we've learned over the past couple of decades. So topic number 3, well, what does the evidence recommend? Like, we've learned a little bit about what it shows and kind of thinking about it big picture. But okay, if we're going to be studying this, how much exercise is okay? Like, what do the studies show? And although there are lots of studies on exercise and fertility, they all differ. Like, they all differ in patient population, how many patients they studied. They differ in the questions they're trying to answer, the approach to actually making the study to try to answer those questions. And they find that some exercise and some type of body movement do improve fertility, but they do warn learn about too much exercise is not a good thing. There's an excellent meta-analysis published in 2019, and it really helped review the data critically and tried to help kind of put it all together. The authors concluded that physical exercise, along with nutrition, is very important for fertility. And people who were exercising on a regular basis had 2 times the likelihood of getting pregnant in a shorter time period. Benefits of exercise were most seen in certain patient populations: obese patients, patients with polycystic ovarian syndrome, and patients with proven insulin resistance, and that moderate physical exercise did not harm fertility. The authors recognize how different the studies are and how hard it is to come up with a conclusion, but they're saying exercise is great. It's good for fertility to move your body, but you don't want to push your body to extremes. So topic number 4, what about specific scenarios? So there's a lot of studies on polycystic ovarian syndrome and exercise and just how beneficial it is. PCOS, or polycystic ovarian syndrome, is a common hormonal disruption. It's really a metabolic disorder with different elevations of hormones, like more male hormones, androgens like testosterone and DHEA, out of balance. It's associated with insulin resistance and, again, metabolic disorders. But it can be associated with infertility, especially if someone is having irregular or no ovulation. That can be a side effect or a way that PCOS shows up in a lot of my fertility patients. And PCOS benefits from regular exercise. There's a wonderful review article here that looked at 5 different studies specifically around PCOS and exercise and its benefits. And they showed that with 12 to 24 months of exercise, I know that sounds like a long time, improved hormone levels, improved regular ovulation, and a shorter time to conception. And what is really cool is that this benefit is seen without necessarily a reduction in weight. So such a trigger point for so many of my patients with PCOS is they went to a doctor and the doctor said, oh, you've got PCOS, just lose weight and you'll get pregnant right away. You'll start ovulating right away. And it's just like, oh my gosh, this person does not understand this metabolic disease and how it's easy to just lose weight, in air quotes. So I just want to reassure you, especially one of the studies that is mentioned in this review study looked at about 40 minutes of walking or sort of moderate exercise 3 or 4 times a week in patients with PCOS was associated with more regular ovulation and shorter time to conception without any change in the number on a scale. So I love that. I love sharing that with you. Another group of patients are patients who are considered obese and they're trying to conceive. So they don't have PCOS, they have regular menstrual cycles, trying to conceive, but lots of studies have shown in lots of different ways that having a higher body mass index, which I know is not an amazing study point, but it's what we have most of the time, is associated with longer time to conception, higher risk of miscarriage and pregnancy complications. And moving your body with obesity can improve your overall fertility and shorten time to pregnancy. And it doesn't necessarily have to be associated with a significant drop in numbers on a scale. One study showed that natural conceptions can improve with physical activity in obese patients without this change in numbers on a scale. And I love sharing that with people because I feel like if the end goal is always to try to fit a number on a scale, it can be so easy to get defeated. But if the end goal is to improve your overall health and maybe to improve your hormone levels and balance and maybe ovulation in cases of PCOS or even obesity, that you're improving your overall health and you're shortening the time to conception, you're improving the chances of success with fertility treatment. It doesn't have to focus on this number on a scale. I know I'm emphasizing that so much, but I really want to encourage people to move. It also helps with mental health and so many wonderful things. And so I like to really kind of point out the big picture in this and support with the studies that I'm sharing here. And finally, what about a group of patients, people who are going through IVF? So a lot of people going through IVF are told, stop working out. It's dangerous to exercise while you're going through ovarian stimulation. Well, let me tell you where this comes from. So IVF is giving gonadotropins to recruit multiple eggs, and the ovaries enlarge as the follicles that are holding the eggs enlarge. And ovaries are suspended on these little ligaments in our abdomen and pelvis. And if the ovaries are enlarged and they get lopsided, they can have something called torsion, where the ovary actually twists on the ligaments. And guess what's in those ligaments? Blood supply. So if someone gets ovarian torsion, it can be a medical urgency, like significant pain, and you sometimes need to actually have a surgery to untwist the ovaries. So when the ovaries are enlarged during an IVF cycle, you're at more risk of ovarian torsion. So you want to really think about the type of exercise that you're doing. Talk to your doctor about what is recommended, but you don't want to do a lot of twisting exercises or, like anything where you could sort of twist your body, really quickly. You want to think about like kind of moderate, sort of easy exercise, anything that's avoiding that twisting because of the risk of ovarian torsion. So again, that's where this comes from. I don't tell my IVF patients that they have to completely stop exercising. I say, let's talk about modifying. Tell me what you do. Okay, you do yoga. That is absolutely fantastic. But let's not do inversions. Let's not do crow or headstands in your yoga class. Let's just like kind of do some nice stretching. You love to swim? Love it. Fantastic. That is great. But when you get to the end of the pool, just turn around. You don't need to do a flip turn in order to go back the other way. Little modifications like that. I hope that that's helpful. So let's recap. We've talked about a lot today. We talked about just the general benefit of your overall health and well-being for exercise in general. Then we talked about how it can truly benefit your reproductive health and hormones, ovulation. We went through studies that sort of talked about how there's a balance of how much to exercise, how much is too much, how much is too little. And then we went through some really specific scenarios, groups of patients who have PCOS, obesity, and IVF, and where the intersection of exercise and fertility comes in those specific groups. I would love for you to take away a positive message that exercise is beneficial and important and something to continue with advice from your doctor about your personal situation. But you really might want to modify and you might want to think about trying to make it a part of a more regular routine because sometimes it can be really, really helpful. I hope you learned something from this. Like this video if you learned something. Comment with questions that you have. Be sure and subscribe to this channel so you get my weekly videos all about reproductive health and my podcasts on the podcast playlist. Until next week, wishing you love, luck, and pineapples.